Now, what is the difference between a droopy eyelid and droopy eyelid skin? And these are two different things, and there are specific treatments for each of them, and they don't really overlap. So a droopy eyelid is when the eyelid itself, the edge of the eyelid, is sitting in a low position, whereas droopy eyelid skin is where the skin hangs over, but the eyelid is sitting at the right level itself. Let me point this out to you in an actual example. You can see this patient has a droopy eyelid on this side. So the eyelid is hanging low and it's actually covering her pupil in the way of her vision. Because the eyelid is low, it's created this larger shelf of eyelid on this side. Now the other side, she has a little bit of extra eyelid skin. It's not drooping into her vision, but that's loose eyelid skin versus a low-hanging eyelid. So to correct the low eyelid, we call this ptosis repair or droopy eyelid repair. And so I've actually gone inside in the eyelid crease and tightened the muscle on that side. So you can see that the low-hanging lid is now higher and she can see through her pupil. On the other side, we've removed just a thin strip of skin so she has a little more eyelid shelf showing, and now you have symmetry between the two sides. Another thing that we've done with her is we've placed a little bit of filler underneath her brow. Now, how does filler lift the brow? When we lose fat under our brows over time, things start to sag and they go downward. By replacing that volume, you can actually create lift. So you can see she has an arch to her brow, but with some filler, her arch is improved and she looks rounder here, which looks younger. So we have a combination of treatments for her. Improvement of a droopy eyelid or ptosis correction. We have improvement of extra eyelid skin or an upper eyelid lift. And we have brow filler or non-surgical brow lift.